Dr. Jennifer Lee, Chairman of AIC, Professor Philip Chu, Group CEO, NHG, Dr. Jason Chia, CEO AIC, and Dr. Eugene So, CEO of Tan Tock Seng, and not forgetting our organizing chairman, Dr. Mark Chan and Mr. Michael Po. Distinguished speakers, judges, patients, caregivers, community partners, volunteers, and fellow healthcare colleagues. Very good morning to all of you. I'm extremely delighted to join you at this annual Singapore Patient Conference and the launch of the inaugural Singapore Patient Action Awards. I remember I was here at this same conference exactly 1 year ago, and I was extremely touched by some of the stories shared by some of the patients as well as the caregivers. And since starting this conference 2 years ago, this has now become a very useful platform to hear from our patients directly, and for healthcare professionals, our partners, and the larger community to engage in meaningful conversations to improve patient care. And through these conversations, important partnerships are also formed. This year's conference is a good example with the National Healthcare Group and the Agency for Integrated Care, or AIC, coming together to organize this conference. Such partnerships are needed to support our focus on delivering patient-centric care. Today's theme on addressing caregivers' needs and celebrating caregiving resonates with me in a personal way. Being a doctor as well as a member of parliament, I have met many caregivers from all walks of life who shared with me their challenges in caring for their loved ones. The stress is both physical and emotional, and sometimes can be financial as well. And caregiving is indeed a complex and arduous journey with a commendable sacrifice. There are about 210,000 caregivers in Singapore today. As our population rapidly ages, this number will continue to grow, and it is our collective responsibility to ensure that we are better prepared for the heavier caregiving responsibilities ahead. It is with this in mind that our healthcare and community partners, some of whom have been invited to speak at today's conference, have taken concrete steps to enhance caregiving support and expand the network of resources available. First, we have made it easier for our caregivers to seek help and support. AIC has expanded on its touch points to make care transformation more easily accessible to our seniors and their caregivers, such as the Singapore Silver Pages portal and the Singapore Silver Line, a national elder care helpline. AIC has also collaborated with the regional health systems to set up iCare links at 4 restructured hospitals. Today's opening of iCare link at Tan Tock Seng Hospital is the newest addition. Many of you had asked for the personal touch when seeking help. iCare links in the hospital will allow caregivers and their families to speak directly with care consultants to assess information on care services, assistance schemes, and grants. More than 12,000 patients have used iCare links services to plan their post-discharge care options to date. Second, we want to provide better training to equip caregivers with the right skills and know-how to take on the caregiving role with greater confidence and ease. The government introduced the Caregivers Training Grant in 2007 to support caregivers with up to $200 each year to attend approved caregiver training courses. Since its inception, more than 29,000 have benefited from the grant. And in 2014 alone, more than 7,000 caregivers have tapped on this grant. Beyond the grant, we also need patients to train our caregivers. Beyond this grant, we also need partners to train our caregivers. And I'm pleased to hear that since its opening in 2013, Care Connect, the Patient Experience Center in Tan Tock Seng, has supported more than 5,000 patients and their caregivers through its suite of 150 training workshops and health talks. It has also partnered voluntary welfare organizations like AWA Center for Caregivers to provide psychosocial training to teach caregivers self-care skills and coping strategies. Today, Care Connect has become a visible gateway where it engages the community with more than 350 active volunteers and a network of 27 volunteer and patient support groups. Likewise, the Primary Care Academy, a training arm under the NHG Polyclinics, has also been equipping caregivers with skills to care for the less ambulant elderly within their own homes. These community partnerships are a key step in the right direction as we continue to work on enhancing training support for patients and their caregivers. Third, we will strive to make quality care more accessible to patients in the community. Through programs such as the virtual hospital and post-acute care at home, Tan Tock Seng partners community providers to support caregivers with care delivery at patients' home. Patients with chronic but more stable medical conditions can be cared for in their homes so that they can recuperate in a more conducive environment. I must congratulate Tan Tock Seng for its efforts in championing the cause for community programs to benefit patients and their caregivers. Today also marks the launch of the inaugural Singapore Patient Action Awards, and I'm honored to have this opportunity to celebrate the determination and resilience of our caregivers and honor those who have gone the extra mile to improve the lives of those under their care. Every award nominee has a heartwarming story, and everyone is a winner today. But I would like to make special mention of Mrs. Heng Chang Yiving and Associate Professor Albert Teo Chu Ying, who are recipients of the Patient Caregiver Award and Patient Advocate Award respectively. They exemplify an age-old Chinese saying, 施比受更有福. It is more blessed to give than to receive. Both of them believe strongly in giving back to the community, and in doing so, they have motivated and inspired others to make a positive impact in the lives of others. Just let me elaborate. Mrs. Heng was a dedicated caregiver to her late husband for 9 years since he was diagnosed with dementia in 2007. To better care for her husband, she read widely on caregiving to persons with dementia and even picked up practical nursing skills to care for her husband, who was battling with sleep apnea and swallowing difficulties. Even as she was coping with the bereavement of her husband, Mrs. Heng agreed to share her caregiving experience at the recent Asian Medical Student Conference workshop on dementia and caregiving. Today, she will actively participate in support groups and workshops to encourage and share with other caregivers on her caregiving experience. Associate Professor Albert Teo is another passionate patient advocate, a familiar figure at the Patient Care Center in Tan Tock Seng, where he has volunteered for the past 14 years. Associate Prof. Teo has been visiting HIV patients with his team of 20 volunteers every Saturday. He initiated the Touch Therapy program, which trains volunteers to provide massages to help these patients relieve muscle stiffness. He has also raised funds for needy HIV patients who cannot afford to pay their medical bills and help some to secure job placements. He even keeps a tab on the patient's families after the patient has passed on. His greatest reward is being able to witness HIV and AIDS victims live their lives with dignity, and this firm belief has kept him going on for all these years. So their stories are indeed inspiring and reinforce the need for us to do even more for our patients and caregivers. I hope today's conference will generate more conversations and forge greater partnerships to support a more holistic and person-centric approach to patient care. We need to continue our efforts as a community to co-create a better caregiving experience for our patients and their loved ones. I will leave you with the words of Brad H. Lewis, a renowned American author of the book on family caregiving. Doctors diagnose, nurses heal, and caregivers make sense of it all. And I wish you all a very fruitful conference. Thank you.